I would like to thank the organizers for their invitation to participate in this meeting. The Laguna 1 program analyzes conventional color fundus photographs to estimate the amount of hemoglobin and its distribution in the optic nerve. This way, we can differentiate its normal perfusion and shape from the ischemia and tissue atrophy that characterizes glaucoma. The program can be used in two distinct ways. Quantitative data are only available to ophthalmologists and must be interpreted along with other clinical parameters and other diagnostic methods. And when used as a population screening method, a risk probability orientation is obtained that guides the need to refer the subject to the ophthalmologist to perform the complementary studies and confirm or discard the diagnosis. The program has been designed by our group at the Spanish company Insoft and is available on the platform of the Danish company RetinaLyze. A few seconds after entering the image, the user receives the indication that the subject is probably normal, that presents a borderline situation with respect to normality, where the limits are set for a specificity of approximately 98%, or that there is a high risk of glaucoma when the level calculated for a specificity of 99 is exceeded. To achieve useful screening results, the procedure must be quick and easy to apply, but at the same time sensitive and specific. To evaluate the criteria to be used for screening, let us admit a prevalence of glaucoma of 3%. If we adjust the program to refer the patient to the ophthalmologist when the result exceeds the 95% specificity level, we will refer 7.6% of the people to the health system for verification, admitting that our program has a 91.9% sensitivity for this level. With this criterion, we will detect most glaucomas with very few false negatives, but we will obtain a large number of false positives, and therefore we will saturate the doctor's offices, which will have to work with more false glaucomas than with true glaucomas. For this reason, it is necessary to use a criterion of greater specificity. If we demand a specificity of 99%, a level for which our method has a sensitivity of 78.5%, we will reduce to less than half the cases that will be referred. This way, false negatives will increase from 0.2 to 0.6%, but false positives will be reduced to a fifth. This is the most convenient solution because false negatives usually occur in incipient glaucomas that can be detected in subsequent periodic examinations. A necessary requirement for a method of image analysis to obtain reproducible results is that it should not depend on the subjectivity of the examiner. To achieve this goal, we have applied artificial intelligence methods known as deep learning to automatically perform various tasks. Firstly, the location of the nerve in the whole image and the limitation of its edges is done completely automatically. Secondly, the central vessels of the retina are automatically identified, which do not participate in the nutrition of the nerve, but which we use as a colorimetric pattern to assess the presence of hemoglobin. Thirdly, the system recognizes the eye as either right or left. Correct identification is achieved in all cases, taking into account the position of the nerve in the image as a whole, the location of the vessels, the increased presence of the hemoglobin in the nasal half, and automatic identification by artificial intelligence. Fourthly, deep learning is also used to check the quality of the images, so that we avoid trying to analyze cases where the optic nerve is not present, is severed, or is very abnormal, as well as very dark, burnt, or blurred. And finally, automatic indices are calculated that identify peripapillary glaucomatous atrophies and other common characteristics of glaucomatous optic nerves. By the end of May 2020, a total of 204,367 images have been analyzed through the RetinaLyze workservice. In addition, we have 2,875 images with diagnostic certainty, which we use as a reference, and 8,635 on a test server that includes the work of several ophthalmologists who collaborate with our group. Once duplicate images were removed, 90% of all images entered into the RetinaLyze platforms could be analyzed. Those which could not be analyzed were either because of the optic nerve not appearing in the image or because its quality was too low. Our program provides a global index of perfusion and morphology, which we call GDF, or Globin Distribution Factor. This index adopts positive values in normal cases for specificity levels above 95% and below -15 in cases with a high probability of being glaucomatous. This figure is the 99% specificity. Analyzing the images collected in the screening study most had positive GDF values and 4.4% were below the 99% specificity. If we add those suspected of glaucoma to this percentage, the frequency will be slightly higher than 2.1 and 5.8% of the adult population, which is admitted for glaucoma, but we must take into account that patients suspected or previously diagnosed are most likely to accept to participate in this type of works. In the case of the images included in the platform of the company RetinaLyze, we do not know the final diagnosis of the cases that were referred to the health systems for diagnostic verification, but we can make an indirect verification by observing if the results coincide with what we have observed in our reference cases. Our series currently include 1,438 normal subjects and 1,437 confirmed and suspected glaucomas. The images were obtained with different cameras and correspond not only to confirmed glaucomas, but also to subjects with any type of suspicion. In the image, you can see how for a specificity of 95%, the sensitivity is at 91.9%, and for a specificity of 99%, the sensitivity was 78.5%. In our normal series, only 5% of the subjects had a vertical disc cup ratio greater than 0.58. If we take this limit as an indicator that the diagnosis of glaucoma is very likely, we will see that in the group of confirmed and suspected glaucomas, those cases that exceeded this vertical cup disc ratio value generally have negative values in the GDF index. Indeed, if we select from our sample of confirmed or suspected glaucomas, those with a vertical ratio greater than 0.58, the sensitivity increases to 99.5% for a specificity of 95% and to 95.7% for a specificity of 99%. In other words, in confirmed glaucomas, the sensitivity and specificity of our method is very high, so we will send very few normal subjects to specialized centers. However, if we select among glaucomatous and suspicious patients those who have vertical coefficient lower than 0.58, the sensitivity will obviously be lower, because many of them are really normal, but even so, the method detects glaucoma in more than half of the cases, keeping the specificity at 99%. If we compare the frequency distribution of the cases analyzed in screening with the normal control cases of our reference series, we observe that in both cases, the most common value of the GDF index is 25, but in the screening series, its frequency is lower because the sample contains other cases with negative values, which correspond to the glaucomas detected. Thank you for your attention.